Hi everyone. This is Sapna Bro. I'm one of the pediatric oncologists in Winnipeg. And I just 2 minutes before asked Lindsay, why don't you join the presentation as well? And she was so kind to.
Hi everyone, I'm Lindsay Jibb. I'm a nurse scientist here at ACCESS-ACCES.
We will be presenting on behalf of our other colleagues, which are Leandra, Vicky, Lindsay is here, Paul, Fiona, and Chantal. And our team is basically looking at ways to improve the psychosocial outcomes of children with cancer and also their survivorship care. So the overall objectives of our team are to improve the quality of life for children with cancer, not only during treatment, but also during the survivorship period. And we are also looking not only to improve this for the children, but also for their families. So that's the focus is family-centered, and including the prevention and management of short-term and long-term toxicities with the overall goal of improving their quality of life and outcomes. So the team priorities are identification and pilot implementation of a comprehensive measure, which includes a various which could be actually a composite patient-reported outcome measure, which can be used to address, to measure the psychosocial health of the children with cancer during treatment, but also during survivorship period. And similarly, we also want to identify the patient-reported tools, which can be used to measure how parents and how families of children with cancer are doing during treatment and also in the survivorship period. And these two aims are primarily related to the psychosocial aspect of our theme, whereas for the survivorship aspect of our theme, we have focused on implementing a passport for care, which is basically a survivorship care plan. Passport for Care is actually a web-based clinical decision support tool, which is headed by Baylor College of Medicine and Texas Children's Cancer Hospital in the United States. So it's a web-based tool which helps to come up with the recommendations for follow-up for childhood and young adult cancer survivors based on their diagnosis, treatment exposures, and it automatically links the diagnosis and treatment exposures to the most up-to-date children oncology group long-term follow-up guidelines. So with the help of that, we will be able to, we can create a personalized survivorship care plan for the patient. And the most important thing is a patient can have access to this as well as family and a primary care provider and as well as oncology. So therefore, helping in not only developing, but dissemination of the knowledge is, will be helpful. And this is a tool which can be updated with the most, as the guidelines get updated and there are health links. So there are two centers in Canada who have already implemented it, one in Manitoba and another in Halifax. So we have had meeting with Passport for Care team in states and they are willing to work with us. So we are having a meeting with other centers, including Pogo in January to see how we can implement this. So Lindsay will talk more about how we are doing the psychosocial aspect of the our theme.
Yep. So as Sapna mentioned, what we're aiming to do here is really to develop out kind of a comprehensive way of assessing the psychosocial health of children with cancer survivors and their family members. And then maybe using that to screen this group for targeted psychosocial interventions. This is work that's really come right out of the community. It came out of some of the early work that we did, but also a town hall that we held way back in February, where the community really told us this is where you should put your focus. To date, we have conducted maybe the first 50% of a large scoping review to look at available psychosocial measures that are out there, look at their validity and reliability and see which ones might come together into a nice kind of package that we could implement clinically to assess the group. We are then aiming to develop out in concert with the community this kind of more targeted screening instrument and implement it at probably a few centers across Canada as kind of proof of principle. Can we get screening into practice and can it implement or can it affect change for the group?
So basically, so these are the two projects which I have prioritized, and what is most important also for us as a team, and also as an organization, ACCESS organization, is engaging the patients and families authentically and meaningfully as we move forward with our projects in future. We are also, these are the 2 projects which have been approved, but we are also looking at, as Lindsay mentioned, doing a pilot implementations at few centers to see what we can learn from it and how it can be nationally implemented eventually, both of these projects. There's also a vision for developing a catalog of electronic as well as mobile-based health applications, which can provide resources to the patients but during treatment and their families, and also during survivorship. And this is where we can see there will be a lot of communication with other teams as well as the ones who are focusing on education. And we hope that with this work, we will be able to achieve a national systematic approach to psychosocial health screening, which has been missing in our centers. I would say in most of our centers presently, and I hope we can do this throughout the whole cancer trajectory. And second is to develop a national systematic approach to monitoring and managing late effects in childhood cancer survivors. And as we do that, there will be opportunity to link that data to already existing databases such as CIPSI or POGONIS, so that we can not only improve the clinical care, but also learn from it to further advance the field of oncology. And we hope that we'll be able to improve the quality of life and outcomes of pediatric in patients with cancer. Thanks.